And I tell you, I'm the official ambassador on the AM show for the Breast Cancer Awareness Month. Yeah, you know, told you about examination and all the things that we have to do. But, you know, creating the right education and how all of us who could be affected could get the right sort of medical treatment or the examinations in the first place as preventive care is very important. And we'll continue with the conversation. As always, partnering us for this month is the Nyaho Medical Center. And I'll tell you where they are located. And just in case you don't know, you can always get to them. But we have the family medicine resident at the Nyaho Medical Center right here. She was here last week. And Dr. Irajua Kankan-Yeboah is again here, and the Nyaho Medical Center is where she works. Good morning to you, Irajua.
Good morning.
And the feedback I got, particularly over last week, was a load of information, etc. Today, we say we wanted to do some of the practical issues and the lessons, etc. But it's always important to get to know that at the point in time when we say we want to do preventive health in relation to breast care or breast cancer, some of the best practices will be to do what?
So what we are advocating now is for self-examination and also for patients to also report to see their doctors for them to be examined as well. Because with that, you'd be able to pick up any changes that happen as soon as, you know, it happens. And I always tell my patients, it's always better for you to come and then we tell you, oh, it's nothing, than for you to sit at home and say it's nothing and then it turns out to be something. Yes.
When it comes to related to that, the number of deaths are quite high worldwide. Now, when it comes to what we could do ourselves, the examinations are said to be a critical point. But when you do it, what should be some of the things you should look out for?
So the first thing is you want to see if there are any visible changes. Okay, so the first thing you want to do is, and I always say, try to get 15-20 minutes, not rushed. Definitely not when you're getting your kids ready for school and you're trying to rush out. You stand in front of a mirror, whether male or female, you stand in front of a mirror and you're looking for, in plain terms, symmetry. So you want to know, you look at your two breasts, you are trying to say, is one looking suddenly bigger than the other? Any skin changes? Does any part look red? Does any part look darker than normal? Have you noticed any nipple discharge? Any irritation? So it's very important for you to look, especially women who have quite big breasts, or what we call pendulous breasts, which hang.
What do you call it?
Pendulous, so more or less they are hanging a bit. So what you also want to do is that you also want to lift the breast and also look at the undercarriage, so to speak, in the mirror, because from the top you can just see the front. So that's really what you're looking for. The other thing that you want to do, and I'm going to demonstrate it with later, is
oh, it's right now.
Okay, so
Michaelina is here, has volunteered to do this,
okay.
And because of you know, concerns we have about what should be sexual and not, so I mean, she's wearing a t-shirt, but then we're going to get the import of what we want to do by way of the self-examination. So you can just go behind your chair.
Okay.
And let's see if we can get some practical lessons on this point. And as you do it, also you can explain to us what it means. And should we always do this lying down?
So I think you can do it lying down, but you can also do it standing.
Like this?
Like this.
And what should you do?
So first of all, I hope it's okay if I... Thank you.
Okay.
It's always good to get consent from the person. Thank you so much. So like I mentioned, you stand in front of your mirror and you're looking at both breasts. You are trying to compare to see if you notice any changes in one that were not there before or that isn't in the other one. So you're looking for skin changes. You're looking for if the nipple suddenly has gone in where it used to be protruding before, any swelling. And like I mentioned with the pendulous breast too, it's also important for you to lift the breast and also look underneath it to see if you see any of those changes. So that's the first thing that you do. You shouldn't be in a hurry to just touch the breast. You want to just look at it and spend a good 2-3 minutes.
So that is like the physical examination?
That's the physical examination. That's the first part of the physical examination. So you are just looking at that, spend a good 2 to 3 minutes just really looking, really paying attention.
In front of the mirror.
In front of the mirror. In front of the mirror for the self-examination. When you're doing it with the doctor is the one looking, so that's all right. But for your self-examination in front of the mirror. The second thing you want to do is, and I'll stand a bit away from you, is to stretch out your arms.
Can you stretch?
And then slowly lift them up, above your head. Okay. And then you slowly bring it down again. Okay.
And now why is she doing this?
What you're looking for is to make sure that the breasts are rising and falling uniformly. Okay. So during the process, you want to see, are they moving in synchrony? Is one part pulled to the other? There's a term we use as tethering. So you realize that it's as if one part is fixed. So when it's moving, it's like that side is pulling it and it's not able to move as it's supposed to move.
When that happens, then what would that mean?
So when that happens, then we begin to question, is there something wrong at this point?
Because that place becomes turgid, kind of hard.
It's more like, not,
that's why
it's more like it's not moving up. So it's more like the tissues are more like fixed. Yes, so that's how come it's not able to move freely. So that's another thing that you do. You can do it twice or thrice just to convince yourself that everything is okay, okay? And then you get to the actual touching process, okay? So what we recommend is that you take the breast as a globe, and then
before we go there,
yes.
When it comes to the, I think for many people, they seem to assume that for somebody like Nikki's age, I'm not supposed to be, but I know I've had an experience in which a 22, 23-year-old had a lump. And she got to know by doing the examination. And she'll Mickey will think that I'm young. I'm 21, 20, 22, 20. Why should such young people be doing it?
Young people can have lumps. I think I mentioned it last week that sometimes you would get a lump. It's not breast cancer. We have what we call the fibroadenomas and many are breast cysts and other issues. Now the trick is that we want to find these things early, and if it's those things, we take care of it. And in the rare occasion that it's breast cancer, if it is, then we can deal with it. Okay. But a recent study was done actually where they found out that for Africa and Ghana specifically, more people, younger people are getting the breast cancer.
Because for this particular incident or case, the person had a lump. Okay. Initially, it was said not to, it was okay. What do you call it? Benign?
Benign.
Benign.
Yes.
And then after a year, it was said, well, we're not too sure. Wait, let's get it removed. Why?
So a lot of times it's with the patient's preference, okay. Sometimes these masses are benign, and the only way you can truly confirm is when you do the biopsy. So what they do is they use a little, yes, and they'll tell you it's benign. But you know, a lot of people feel self-conscious, they feel uncomfortable with your partner touching. So some people decide, yes, it's benign, but I still don't want it.
So now do the physicals on this.
Okay, so you use the nipple as the center of your circle, okay, and then you divide the breast into 4.
And you divide the breast,
you
like
divide the breast into 4. The single breast
so like this
into
one,
4.
You do it into 4.
Exactly. Please don't get too close to my patients. Thank you. So you use that, and then what you are aiming for is to make sure that you've covered every quarter of the breast region. Okay. So you start from one quarter. I choose to start from here, and then what you're trying to do is you get Michaelina to raise her hand. Could you raise your hand and put it at the back of your head? So what that does is that it tenses the muscles behind so that you know that what you are feeling is the breast tissue. And then you firmly, but not painfully, you press it against the chest wall. So you are basically just pushing the breast tissue against the chest wall, trying to see if you find any mass or anything that will cause you
And you can do this wearing a shirt, right? Like the way Michael.
No, so we are doing this for public TV, but ideally you should do it bare-chested. Okay. Yes, not even in a bra. You should do this bare-chested. Okay. So you do that, and then you do the nipple region separately, and then this area, which we call the axillary tail, is actually part of the breast tissue.
Axillary tail.
Yes, of the breast. So what you want to do is that you also want to go up and also feel there, because this is all, even up there, because this is all breast tissue. And sometimes some of these lumps too may find themselves there. So you really want to know, okay? So you check for that, and then when you're doing the second breast, you just do the same thing for the second breast. Okay. I think.
Yeah,
is it,
yeah, she should turn.
I think
just
it's
face the camera,
just face. Yes. So.
Okay. And what should you be looking out for? Because you know it's just as if you're. I think most breasts, if you take them, they have these lumps in. So sometimes, which one do you get to know whether it's just the normal one and not the when you're doing this?
So, of course, since I've had some exposure, I would be able to know.
Okay.
But the key is that what we are advocating for is for you to do it regularly. The truth of the matter is that women's breast composition changes slightly depending on the phase of their cycle. So when you are getting towards ovulation, the breast tissues feel a bit different. When you are getting towards your menses, it feels a bit different. So what we are saying is do this regularly so that you'll be able to tell that, okay, this is how normally to feel even with ovulation, even with menstruation.
Okay. So the regularity is because you want to know if there are changes over a period.
You want to know if there are changes over a period.
And you can only notice if you do it regularly.
Exactly.
Fantastic. I think that's good. Are we done with that?
So for now, what she can do basically is done. When you come to the hospital or the clinic setting, there are other things, other maneuvers that we do to help us to check. And so one of the things we can do is also to put her hand on the waist and then just flex your shoulders in. So more like, yes, exactly.
And why is she doing this?
So again, is to tense the chest wall muscles, what's behind the breast tissue, so that you can feel the actual breast tissue.
But this is at the hospital.
This is at the hospital because obviously when both of your hands are here, you can't do that. The other thing that we also try to do, so you do it for both, is that you try to express. So what you do is that we gently press, but when it's you can just use one hand to sort of try and milk the breast to see if anything will come, any discharge would come.
If there's a discharge?
If there's a discharge, then you report to your clinic.
Is it normal for you to have any discharge at all in the breast?
It's not normal. Unless, of course, you are breastfeeding, then, of course, some breast milk would come. But other than that, you shouldn't have anything coming. So once you express and you see something, you report to the clinic and then
But they also say that, okay, maybe this one, if you know, men like sucking breasts in the act of the sexual encounter. Does that also play a role to know whether there will be a discharge, so you have to tell your partner that it looks to be that you have a discharge?
So, well, I mean, if the gentleman in question does find something, then he would let you know.
Okay.
But usually that shouldn't cause any. Yes. And then the last part, which we do at the clinic, is also to check for lymph nodes. And then what we do is that we check in the axillary region or the armpit region to also check, because sometimes what happens is in a few cases the breast cancer may not present as a very big mass in the breast, but you check and then the lymph nodes will have gotten a little bigger.
I see.
And then they would also check.
And the lymph nodes, are they also masses?
They are also masses. They are also small masses. And then you just find then she's done. Thank you very much.
Thank you, Mickey. Thank you for volunteering.
Thank you very much.
Please, you can have your seat,
yes.
Iraja. But but then if you find a mass and you hadn't noticed it, let's say a year or two ago, what should you do?
So what you should do is you book an appointment with your doctor as soon as possible. Okay. The doctor will also re-examine you. Sometimes they'll ask for imaging studies. That's either an ultrasound or a mammogram, depending on a number of factors, the age and the texture of the breast. Let me put it that way. So after we do the imaging studies, they go further to do a biopsy. Like I mentioned, they take a sample of the tissue to find out exactly what it is. And then depending on whether or not there are lymph nodes present and whatnot, if it's cancer, then they decide what kind of treatment that they are going to do for you. And with the treatment options, it also depends on the size and also how advanced the breast cancer is. So sometimes they just take the lump out and they do the take out. If there are immune lymph nodes, they take it out. Okay.
So if they would need to treat at all, at what stage would they start doing a treatment for you? And then how would you classify that stage?
So usually cancer would be treated. Okay. So we are not going to say,
so immediately the doctor says, come and let's go and do this, and then you know that it's turned cancerous?
So like I mentioned, the confirmation usually comes from the biopsy. So if the biopsy comes back and it indicates that it's a cancerous growth, definitely there's going to be some treatment. they'll definitely try to take it out, and then depending on how advanced the stage is, that's when other modalities also come to play, whether chemotherapy, radiation therapy, immunotherapy is also an option, even hormone therapy, because some of the breast cancers are found to grow more when they are exposed to estrogen and progesterone. These are certain hormones which are produced by the human, the female body. Yes, so all of these things have to come into play and be considered.
Expensive in our setting? Knowing that there are many women who, and then those who are affected, that small number of men also could not be in the right categories of income earning.
Well, treatment is actually covered by the health insurance, and actually the treatment goes as far as breast reconstruction. So even if they need to take
insurance?
Under health insurance, so even if they have to take off the breast, health insurance covers for them to reconstruct a new breast so that you still feel good within yourself, you still have your self-esteem, and you can walk around without that stigma for other people. Yeah.
Oh, that's what it is. And apart from Nyaho, you can get treatment elsewhere. That's it, right?
So basically for the chemotherapies, you would have to go to big hospitals with oncology units. Yes, like Kolebu, Komfanoche Teaching Hospital, and I think UCC. Yes. But in terms of the surgery, a lot of people can have that surgery done. And a lot of people actually do them because in these places, the burden is so high that even when they want to do the surgery for you, they have such a long waiting list that the weeks or months that you may be given, it may cause the thing to advance. So now a lot of people, if it's in a stage that they can deal with it, they will take it out and then refer you for you to go and continue with chemotherapy and whatnot.
The pictures that we tend to see, I think more of in the advanced countries, especially find on YouTube, etc. People who have undergone some form of either radiation or chemotherapy, and sometimes their hair is falling off. So some of them tend to survive, though.
Yes. So the chemotherapy tends to be a bit taxing on you physically. Now, the whole thing is that it's trying to kill all rapidly growing cells, which is the cancer. But there are other cells in the body too that also rapidly grow, like your hair. Because your hair is constantly falling out, but you don't realize it because new ones are constantly growing too. So yes, those are areas which tend to be affected. Your bone marrow is producing all these blood cells, so it also tends to take a hit. A lot of people tend to do well on chemotherapy when they present early enough, and when they are still that strong. But usually, depending on how advanced the cancer has gotten to, some of the people may not be in a good state. So at that very advanced stage, the doctors may even opt to say, I don't think you should go to chemotherapy because you wouldn't be able to withstand the brunt of it. Yeah.
And I get to find that I've read stories, and mainly they are of those who have publicized their encounters or experiences. They usually will be celebrities in the advanced world. And sometimes you get to find that you may be out of it, you're safe, but they keep saying monitor. And why is that?
And that's because the cancer could recur, especially in cases where the cancer had spread. So what they try to do is that they try to take as much of it as they can out, what they can visibly see. But sometimes it's so microscopic that you may not be able to pick up.
And by the time you pick it up?
And by the time you pick it up, yes. But what you want to do is you want to monitor it, because even if it recurs, they can still give you some treatment to get rid of it, provided they pick it up early enough.
Okay, so my last question then will be, is there support in Ghana? Is treatment possible? Because people will have the myth that when I have breast cancer, it means that or I have any problem with my breast, I'm about dying.
The treatment is very possible, and that's why we are doing all of this awareness, so that people will know, first of all, pick it early. Secondly, if you pick it up, we can do something about it. So treatment is very possible. Treatment is covered. It's not as expensive as one would think. So yes, treatment is very much available in Ghana.
Thank you very much. I've enjoyed this conversation. And next week we'll look at family support systems and how also we can make sure that we do the support systems in such a way that people could get help within the society. And I hope that we'll enjoy that conversation as well. Thank you very much. I've had this discussion with Dr. Irajuwa Kankan-Yeboah, a family medicine resident with the Nyaho Medical Center. And I know you have how many centers around here?
Two.
Yes. The one at
Octagon.
And then
the one at airport.
That's the main one.
Yes,
the first
yes,
one.
Yes,
okay.
Yes.
And please make sure that you go check up their sites, and they're always available for you to get the best of treatments. But